And welcome into To Your Health of All Your Senses. Probably one of the most enjoyable one is the ability to hear. It opens up a world to everything that goes on around you. But if you're having problems with your hearing, you may want to check and find out what's causing it. Our guest today is Dr. Christi Rose, and you're an audiologist with Beltone.
Yes.
And we're glad to have you with us.
Thank you for having me.
Great. Well, a lot of our people want to know, how do we know, what actually happens internally with your ears as you age? You know, we see the skin get wrinkles, and we get a little forgetful. But what happens to us from our ears?
Most people that come in with the complaint that they have understanding issues.
Mm-hmm.
They'll start noticing that they have to ask their loved ones to repeat more often. It's usually not a hearing issue. It's more of a misunderstanding what someone says.
And that could be planned. Absolutely.
Yes.
Yeah. So that's one of the major things, or can it be the fact that sometimes you're in a crowd and you can't hear what the speaker's saying if you go to a luncheon or something?
Yes, that's also a big complaint. Hearing and background noise.
Mm-hmm.
If they have hearing loss, it makes it a lot more difficult to hear in those noisy environments. So we are trying to encourage everyone to come when they start noticing those problems and come get a hearing evaluation.
Sure.
And at Beltone, the hearing evaluations are at no charge.
Mm-hmm.
So it allows people to hopefully identify their hearing loss sooner and do something about it so they are able to hear and understand their loved ones.
Yeah, and the other thing too, I think, is for our viewers, obviously if you're watching this show, you say, I can't really hear what they're saying real well, and you're taking that remote and hitting that volume.
Absolutely.
That could be another sign that maybe you're going to have some kind of hearing loss. When you're in the car with the radio,
Yes.
you turn up the volume. It's very interesting in television, because a lot of times when you're watching the program, everything seems to be like this. Then the commercials come on. It seems like they're louder.
Yes.
Maybe they're trying to get your attention.
Yes.
Yeah, but
especially
that can happen too.
Yes, especially when we get up to leave the room.
Amen. Yeah, they want to make sure they follow you.
That's right. And that is a very big complaint too, is hearing on the phone and understanding television.
Mm-hmm.
I hear a lot of spouses say, the other spouse is blasting me out of the house with the television.
Isn't that something?
Yes.
That can happen. So you come in for a hearing test. How much time does that take normally?
About 30 minutes. The hearing test, it doesn't take long.
Mm-hmm.
And then if we identify that you have hearing loss, we will explain your hearing test and go over the audiogram, which helps the patient understand why they're having the problems or experiencing what they're experiencing.
Mm-hmm.
And then we will do a hearing aid demonstration. We'll program top-of-the-line hearing aids and put them on the patient so they can see what they sound like and show them how much better they can hear with the hearing aids on. Because hearing loss comes on so slowly,
Right.
the patient usually doesn't realize they are missing as much as they are.
Mm-hmm.
It's usually our loved ones that tell us that's not what they said, because the patient thinks you said one thing when you really said something else.
Mm-hmm. So, I mean, as you're aging, does the audio canal that's in your ear, does it kind of start to shrink a little bit, and that's what's causing it, or what? I mean, how do you age inside there?
The cochlea, your outer hair cells, are the main, or the cochlea is the main organ of hearing.
Right.
Those little hair cells will lay down and die, and they just die off, usually due to age, or maybe somebody who worked in a noisy environment, like our military veterans. And once we start having damage in the cochlea, that's when we start seeing hearing loss on the audiogram.
Okay. So basically then it's not really anything that the person's done.
Right,
No,
correct.
It's just something that can be a factor of the environment.
Yes.
If they live, we're very fortunate in the South. We live in a nice, tranquil area. But if you've ever been to a big city and you go to a hotel and you sit there in the hotel room going, how do these people live here? Because that's all you hear all night long, are the garbage trucks and sirens and everything else.
Yes.
But those environments can hurt you also.
Yes, and I think it's comforting for the patient to know it's nothing that they did to cause it. A lot of hearing loss is genetic.
Okay.
You know, if the patient has hearing loss. Someone in their family, mother, father, may have also had hearing loss.
Right.
Sometimes it's no family hereditary. It just you just got lucky to have the gene of hearing loss. But a lot of people will work around hazardous loud noise,
Yes.
like the military or firing guns. Or some sort of occupation that exposes them to loud noise.
That's some good information. Obviously, if people want to get a hold of you, you're in Montgomery.
Yes.
You're on Carmichael Boulevard, so you're close by.
It's 4919 Carmichael Road.
Good, and you're able to give them a free hearing test, as they
Yes.
say. See where it's going to go. And just remember, obviously, it's a precious thing to have good hearing. Take care of it, but more importantly, if you're having problems, get it checked. And we'll be right back right after this.